So we're going to talk about common concerns after facial surgery. The first thing is facelift surgery. When I do facelift surgery, it's a two-part procedure. The first part is I elevate the skin and then I tighten the muscles. While I do the tightening of the muscles, there are stitches underneath the skin that are dissolvable, and after a couple days, 2 weeks, patients can start feeling the stitches. So they feel them on the side of the cheek and they feel them on the back of the neck, and when I'm doing a neck lift, they also feel them in the middle of the neck. That's completely normal. It takes up to 3 to 6 months for all of those little bumps to kind of go away. The second thing that concerns patients are little bumps or redness, especially behind the ear where the incisions are placed. That's all normal, especially behind the ear, as the thick neck skin has been moved to the thin area behind the ear, which is pretty much called your mastoid bone. So the thick skin over the thin bone tends to cause a little bit of scarring, tends to cause a few bumps on the incisions. So that's all completely normal. If there are any things that concern patients, they obviously come in for their follow-ups, and I can do things such as steroid injections or little lasers to improve the appearance of any scarring that may occur around the ears. Redness and bruising is totally normal after surgery, and that tends to collect in the bottom part of the neck, and sometimes if patients develop some fluid collections after surgery, they tend to collect it in the back of the neck or in the lower neck. As the fluid goes away over the next weeks to months, they may feel some thickening of the skin, and that's also completely normal. The other thing patients commonly complain about are little bumps or swellings on the back of the neck. That's completely normal as well, as when we tighten the neck muscles, we move the neck muscles from their old position to their new position. And in that new position, there's a little thickening on the area where the muscles are sewn on top of muscles, and that also takes a couple of weeks to go away completely.